Hi there. If your doctor just handed you a prescription for Pravastatin, you're probably buzzing with a few questions, and that's completely normal. Starting any new medication can feel like a big deal, but you're doing the right thing by learning more about it. So today, we're going to break it all down, nice and simple. All right, so here's our game plan. We'll kick things off with the basics, what Pravastatin actually is and what it's doing in your body. Then we'll get into the nitty-gritty of how to take it correctly. Of course, we'll talk about side effects, the common stuff and the serious stuff. We'll also cover crucial warnings and then wrap it all up with a handy safety checklist so you can feel totally confident.
Okay, let's dive right in. Section 1. What is Pravastatin? Getting a handle on the what and the why is really the foundation for everything else.
Whoa, okay, that first part is a real mouthful, isn't it? HMGOA reductase inhibitors. Don't worry, you don't need to memorize that. The only word you really need to remember is statin. You've probably heard it before. Statins are a whole family of medicines, and they're one of the most prescribed drugs out there for protecting heart health. So how does it actually work? Well, think of your liver as a little cholesterol factory that's working 24/7. Pravastatin basically goes in and tells the factory to slow down production. By making less cholesterol, there's less of that fatty stuff or gunk available to build up inside your arteries. This helps keep the blood flowing just how it should. So that brings us to the big why. Why you? It's all about playing defense for your heart. The main job is to get your cholesterol numbers in a healthier range. That means lowering the bad stuff, your LDL, and boosting the good stuff, your HDL. But the end goal is so much bigger. It's about seriously cutting your risk of having a heart attack or a stroke, and in some cases, even helping you avoid major heart surgery down the road. And hey, you don't just have to take my word for it. Look at this graph. It's from a huge clinical study. The top line shows what happened to people taking a placebo, a sugar pill. The bottom line is the group taking Pravastatin. You can see, clear as day, that over time, the Pravastatin group had way fewer major heart problems. That's not just a small difference. That's powerful proof that this stuff works. Okay, so we've covered the what and the why. Now let's get practical and talk about the how. Taking your medicine the right way is absolutely key to getting all those benefits we just talked about. And the good news is, it's pretty straightforward. Rule number 1, and it's the most important, always take the exact dose your doctor prescribed. Don't change it on your own. You just take it once a day, and it's a great idea to take it around the same time every day. That just helps you build a solid routine. And here's a nice bonus. You can take it with food or on an empty stomach. Whatever works for you. Now, you'll see a number on your pill bottle, and you might wonder if it's the right one. Well, the dosage is tailored specifically to you. For most adults, the starting dose is somewhere between 40 and 80 milligrams. But as you can see, it's different for kids or for someone who has kidney problems. Your doctor will use your blood test results to find the perfect dose for your body and your health goals. Okay, pause. This part is super important if it applies to you. Some people take another kind of cholesterol drug called a bile acid sequestrant. If that's you, the timing is everything. You have to take your Pravastatin either at least 1 hour before that other medicine or wait a full 4 hours after you take it. This is to make sure your body can absorb the Pravastatin properly. All right, let's talk about the big one, side effects. This is usually what's on everyone's mind when they start a new medicine, and that's totally understandable. We're going to break it down so you know what's pretty common and usually no big deal versus what's rare but really important to act on. First things first, let's get some perspective right from the source. This is a direct quote from the FDA's data. It says that for most people, any side effects they have are typically mild and they tend to fade away as their body gets used to the medication. That's really reassuring. Now, this chart is fascinating. It shows the most common side effects, but look really closely at the numbers. For muscle pain, about 10% of people on Pravastatin reported it, but so did 10% of people taking a placebo. And for things like nausea or headaches, the difference between the drug and the sugar pill is tiny. This just shows that these are things that happen in everyday life, and they might not be from the medicine at all. Okay, now for the serious stuff. Pay close attention here. While these are rare, you need to know the warning signs. The number one thing to watch for with any statin is muscle pain that you can't explain. It's not from a workout, it just hurts. Also, keep an eye out for any signs of liver issues, like yellowing skin or eyes. Severe stomach pain, a bad rash or swelling, or a cough that just won't quit are also red flags. If you experience any of these, don't wait. Call your doctor right away. This brings us right to our next critical section, all the other important warnings and interactions.
Knowing this stuff is absolutely key to making sure you stay safe and healthy while you're on this medication.
So, as we just mentioned, the biggest warning for this whole class of drugs comes back to your muscles. In very, very rare cases, muscle issues can turn into a serious condition called rhabdomyolysis. It's a scary word, but all it means is a rapid breakdown of muscle that can be tough on your kidneys. Again, the risk is incredibly low, but it's why we take any new and weird muscle pains so seriously.
That muscle risk can also go up if you're taking certain other drugs. This is exactly why your doctor and your pharmacist need to know about everything you take. I'm talking prescriptions, over-the-counter stuff, vitamins, herbal supplements, the whole shebang. For instance, another cholesterol drug called gemfibrozil is a definite no-go. For others, like certain antibiotics or immune-suppressing drugs, your doctor will just use a lower, safer dose of pravastatin.
Now let's talk about pregnancy, because the official advice on this has actually changed. For decades, it was a hard and fast rule. Statins were completely forbidden during pregnancy. But back in 2021, the FDA updated that. So what does that mean? For almost everyone, stopping the medication if you become pregnant is still the right call. But this change opens the door for a conversation between a doctor and a patient who is at an extremely high risk of a heart attack. The bottom line for you is simple. If you find out you're pregnant, stop taking the pills and call your doctor right away.
So just to recap, let's be crystal clear about who should not be taking this medication. That includes anyone who currently has active liver disease. It also includes those who are pregnant or breastfeeding, with that one tiny exception we just talked about. And of course, if you've ever had an allergic reaction to pravastatin in the past, it's not for you.
Whew, I know that was a lot of information. So let's pull it all together into one simple, final checklist. Think of this as your personal action plan to help you be a true partner in your own healthcare. Here we go. First, remember this medicine is a team player. It works best when you're also following a heart-healthy diet. Second, and this is the big one, report any new muscle pain immediately. Third, keep that complete list of all your medications and supplements ready for your doctor. Be open about your alcohol use, since that can impact your liver too. Make sure you keep your appointments for those important checkups and blood tests. And finally, if pregnancy is even a possibility for you down the road, talk about it with your doctor before you even start taking pravastatin.
So we'll leave you with this final thought to take with you. Now that you're armed with all this information, what's the most important question you want to ask your doctor? Whether it's about your cholesterol goals, something you're feeling, or what your lab results mean, asking that question makes you the most important member of your own health team. Thanks for tuning in.